All right, so again, welcome to today's session. Today's topic is Get Fit to Quit Using Physical Activity to Quit Tobacco Use. And our presenter today is Dr. Wayne Deryder. Now, if you are interested in obtaining a letter of completion for today's session, you must have individually registered for the webinar and completed the pre-learning assessment. You must sign in to view the live webinar using your first and last name, and you must complete the evaluation and post-learning assessment following the webinar, which will be emailed out later this afternoon. These webinars are being live tweeted on Twitter. Follow the CAMH Nicotine Dependence Services on Twitter at @PSQuitSmoking. To follow the live tweeting or to post your questions, use the following hashtag #TeachWebinar. Now, Wayne Deryder recently completed his doctorate degree in exercise sciences at the University of Toronto. Wayne is currently employed as a research analyst in the Nicotine Dependence Clinic at the Centre for Addiction and Mental Health. He is also an online skills enhancement facilitator for the Public Health Agency of Canada, in which he teaches concepts in public health and epidemiology. Wayne's research interests include the co-occurrence and covariation of multiple risk behaviors, specifically tobacco use, physical activity, and alcohol consumption. There are no disclosures. The Teach curriculum and slides were developed and compiled with funding from the Government of Ontario, Ministry of Health and Long-Term Care. Content of the slides were primarily based on evidence-based guidelines from the following sources. These materials, as well as the verbal presentation and any discussion, set out only general principles and approaches to assessment and treatment and do not replace the need for individualized clinical assessment and treatment plans. Now, before I hand it off, I'm just going to do a few polling questions just to get a sense of the group joining us today. So the first question is, please indicate what type of organization you work for. Okay, so it looks like the majority of you, 20%, are from public health units, followed closely by hospitals at 16%. Great. Okay, and the next question is, what is your current discipline? Okay, so it looks like a large majority of you are registered nurses and or health promoters, educators. Great. And then the final question is what region you're coming from. I'll bring that up. Okay, so it looks like about 20% from the GTA area, also 10% out of the province. That's great to see. All right, so thank you everyone for participating in the poll. It's good to get a sense of the group that we have here today. And without further ado, I'm going to pass it off to Dr. Wayne Deryder. Sorry.
Okay, thank you, Tanya. As Tanya mentioned, today I'm going to talk about physical activity and how it relates to tobacco use specifically as a harm reduction strategy and helping people to quit smoking. Now, seeing how most of you work in the health sector, I'm sure you're all well aware that of the negative consequences associated with tobacco use. So approximately 37,000 deaths are attributed to tobacco use in Canada every single year, and the cost associated with smoking is approximately $17 billion. Now, there are many approaches of how to deal with helping people quit smoking. One is behavioral interventions, which may include quit helplines or counseling, CBT, and another approach is pharmacological interventions, which typically includes nicotine replacement therapy. However, recently we've begun to think about treating and managing tobacco dependence in another way, a new direction. And this is where multiple health behavior research comes into play. So we know that for most tobacco users, there's this co-occurrence of risk behaviors. So tobacco users just don't smoke. They usually are sedentary. They consume excessive quantities of alcohol, or they may have inadequate diets. And in fact, for every health behavior, additional health risk behavior that smokers have, their risk of nicotine dependence increases by about 20 to 25%. So the fact that tobacco users typically have this co-occurrence of risk behaviors or possess multiple risk behaviors suggests to many people that tobacco use could be a gateway behavior to other risk behaviors, like I mentioned, sedentary lifestyle. And if unhealthy behaviors tend to co-occur, and if tobacco use is a gateway behavior for these unhealthy behaviors, then isn't it reasonable to believe that adopting a healthy lifestyle, such as physical activity, could be a gateway behavior for a tobacco-free lifestyle? And this is where physical activity comes into play. Hooray for physical activity. Usually when we look at multiple risk behaviors and the association between behaviors, no behavior is studied more often in conjunction with tobacco use than physical activity. And the reason for this is that over the last several years, we've seen substantial evidence to suggest that physical activity can protect people, tobacco users, from the harms that are associated with tobacco use. So about 10 years ago, there was a paper on physical activity and how it could be considered a tobacco harm reduction strategy. Now, to be considered a tobacco harm reduction strategy, there's approximately 8 or 9 criteria that an intervention or a strategy must fulfill. But I've only listed 3 of them today because I don't want to spend my whole time talking about physical activity as a harm reduction strategy. And these are the 3 criteria that I feel are perhaps most important to discuss today. So if physical activity is supposed to or is to be considered a tobacco harm reduction strategy, then it must reduce the tobacco-related morbidity and mortality. It cannot contribute to nicotine dependence. And it has to reduce the likelihood, or it cannot reduce the likelihood of cessation. Now, whenever I talk about physical activity and tobacco use, I love to throw up this graph right here. I think it really demonstrates to people just how important physical activity is for people who use tobacco and how it can protect people who use tobacco from the negative consequences. So on the left-hand side here, we see the number of years of life expectancy after the age of 65. And on the horizontal axis here, we see there are 2 groups. There are never smokers and ever smokers. And for each group, they're divided into 3 different levels of physical activity. There's high physical activity, there's moderate physical activity, and there's low physical activity. And I think the really interesting part about this graph here is if we look at ever smokers and we look at the high level of physical activity here, we see that the shaded area here that represents the active life expectancy of these individuals is much higher than people who have never smoked and participate in low physical activity. And that this active life expectancy of ever smokers in the high physical activity group is actually comparable to people who have never smoked and are exercising at moderate physical activity levels. So it's really interesting. I think it really demonstrates just how important physical activity can be, especially for smokers. So these results are for men, and the results for women are very comparable. Again, we see ever smokers, high physical activity, and their active life expectancy is higher than people who have never smoked and use low or participate in low physical activity, and comparable to those who are moderately physically active. So, does physical activity reduce tobacco-related morbidity and mortality? Absolutely. The previous graph shows this, that people who are active have a much higher active life expectancy compared to people who are not active and don't use tobacco. So what about the next criteria? Will physical activity contribute to nicotine dependence? Well, studies have shown that physical activity diminishes the urge to smoke and minimizes withdrawal symptoms, so it reduces restlessness and irritability, as many of you may know. But what some of you may not know is that physical activity actually reduces tobacco use. So with this chart here, we have physically active smokers and we have physically inactive smokers. And before I go any further, let me just clarify here that when I talk about physically active smokers, I'm talking about smokers who participate in the equivalent of 1 hour of walking at a moderate pace each and every day. So these are smokers who are walking for 1 hour every single day at a moderate level, or doing an activity that is equivalent to that energy expenditure. So physically active smokers, they tend to smoke fewer cigarettes per day, approximately 2 cigarettes fewer compared to physically inactive smokers. And they've been smoking for a shorter duration. It looks like about 6 years here that they smoke fewer years. However, it's not completely all good news, as physically active smokers tend to smoke at an earlier age. Not much, but it's still a little bit. So, from the previous slide, I think it shows that physical activity does not contribute to nicotine dependence. Okay, we see that it diminishes the urge to smoke, and that people who are physically active tend to smoke fewer cigarettes per day, and they've been smoking for a shorter duration as well. Now, what about the last criteria? Does physical activity reduce the likelihood of cessation? Well, it actually doesn't. It does the complete opposite. Physical activity increases the likelihood of attempting cessation. So again, when we talk about physical activity, we're talking about participating in that 1 hour of physical activity each and every day at a moderate level, which may include walking. And if we look at the cessation attempts among men here, we see that people who are physically active have a 36% increased likelihood of attempting to quit smoking. And for women, the odds of attempting smoking are 37% higher. Okay? So physical activity does help people at least attempt to quit smoking. Now, much of the research that I have discussed so far in this presentation has been cross-sectional studies. And one of the limitations that are related to cross-sectional studies is that they only provide a snapshot of what's going on. It doesn't actually give you a true picture of the association, in this case, between physical activity and tobacco use. So in order to get a better understanding of how physical activity and tobacco use are related with one another, we have to turn to a term that's often used in multiple risk behavior research, and that is the idea of covariation. Now, covariation refers to taking effective action on one behavior, which increases the likelihood of taking action on a second behavior. So, for example, if you have a patient come into your office and for whatever reason they want to lose weight, maybe it's on your advice or another doctor's advice that they need to lose weight. So they begin to exercise, and after 6 months they see significant improvement in their physical activity levels. They're much stronger, they're more physically fit. Does this increase in physical activity levels lead to a change in their tobacco use? So that's the idea of covariation. When we take effective action on one behavior, does it lead to action in another behavior? And I just want to emphasize that what we mean by taking action, we don't necessarily mean that in the case of tobacco use that we have to quit smoking, all right? I mean, ideally that would be the best outcome, that people quit smoking when they're taking action on smoking, that they quit. But it doesn't have to necessarily be the case, okay? A reduction in tobacco use is also acceptable too. So I just wanted to stress that point, that when we talk about covariation and tobacco use, it doesn't necessarily have to lead to quitting. So in order to look at this idea of covariation between physical activity and tobacco use, we've used a longitudinal data set, and it's called the National Population Health Survey, which is conducted by Statistics Canada. And we looked at data from 1994 to 2007. Now, this database, the National Population Health Survey, is observational data. So people are not using any type of intervention to change their physical activity or their tobacco use. And the sample consisted of over 15,000 Canadians, and the participants were 12 years of age or higher at baseline. Now, there were a couple interesting results that came out of this analysis. And the first one was that at baseline, higher levels of physical activity was associated with fewer cigarettes smoked per day, or complete abstinence, which is not really that surprising because, as I mentioned before, people who are tobacco users tend to be more sedentary, so therefore people who don't use tobacco usually participate in higher levels of physical activity. The really interesting part, though, about these findings were that over time, as people increased their physical activity levels and they became more physically fit, we saw a decline in their tobacco use, and many individuals actually achieved cessation. Now, the other association, the flip side of that association, was also true, where people who declined their tobacco use over time also adopted a more physically active lifestyle. Okay? So what we were able to show in this paper was that covariation does exist between physical activity and tobacco use. The adoption of one behavior led to an effective action for another behavior. So, going back to our criteria here for tobacco harm reduction strategy, physical activity does not reduce the likelihood of cessation. It actually helps people to attempt to quit, and it actually does help people to quit smoking as well. Now, so far I've talked about the association between physical activity and smoking and how it helps prevent negative consequences and how it can help people to quit smoking. But there's this one element that we also have to look at. And who are these physically active smokers? Are there certain characteristics that they possess? How can we describe them? Because it just seems kind of puzzling that smokers can be physically active. So we looked at the Canadian Community Health Survey to answer this question of who are these physically active smokers. And what we were able to find was kind of surprising. What we found was that within the smoking population, 1 out of every 4 smokers were physically active. They were meeting this guideline of participating in 1 hour physical activity at a moderate intensity level each and every day. So that was somewhat surprising. We also found that physically active smokers were more likely to be male, they were more likely to be younger, and they were more likely to be single, which is interesting because these same characteristics are used to differentiate between people who are active and inactive in the general population. People who are active in the general population tend to be male, younger, and single. So it's kind of interesting to see that the same characteristics in the general population mirror the same characteristics in the smoking population as well. From here, we also looked at the prevalence of physically inactive smokers. And what you can see here that in 1994, 1995, the prevalence of physically inactive smokers, so people who are not meeting the guidelines for physical activity, was approximately about 21%. And as we go through time here, we see a substantial decline in people who are physically inactive and smoking up until 2007, where the prevalence reaches about 14%. So it appears that tobacco users are getting the message that physical activity is beneficial if they are going to use tobacco use. And we're seeing that as this decline in physically inactive smokers is declining. More people are adopting physical activity. Now, there are a number of considerations that we need to think about when we look at physical activity and tobacco use. There's causality. Now, much of the research that I've talked about today, I've kind of suggested that physical activity leads to changes in tobacco use. I've mentioned that physical activity helps with morbidity and mortality and changes in the way that people smoke, such as they smoke fewer cigarettes a day and they've been smoking for a shorter duration. However, it's also possible that it's tobacco use that leads to changes in physical activity. So maybe people are changing their tobacco use and they figure, well, maybe I should change my physical activity levels as well. And I'll give you an example. One of the barriers for quitting tobacco use, especially for women, is weight gain. They're worried about gaining weight after they quit smoking. So after quitting smoking, perhaps people begin to participate in physical activity because they know they're going to gain weight. So the physical activity is used as a weight management tool. So it is possible that tobacco use can lead to changes in physical activity. And causality is something that we have not really looked at yet. It's kind of what came first, the chicken or the egg, and it's something that we can address in future research projects. Now, much like the general population, we see that adherence is a big problem with tobacco users. They just don't want to participate in physical activity. And as I mentioned, the same can be said for the general population. We still have a tremendous amount of people who don't participate in physical activity in the general population. I think it's roughly 50 to 60% of people are not physically active or do not meet the physical activity guidelines. So how can we help with improving these adherence rates? Well, one of the first things we could do is we could look at what modes or what activities that people are participating in and kind of focus on that. Smokers often prefer to incorporate low-impact activities such as walking or gardening. Skating and jogging are also popular, but they're a little bit more intensive. But walking and gardening, things like that, low-impact activities are usually pretty good for tobacco users. Walking is very easy. It doesn't require much cost or many resources. You just grab your shoes and away you go. Now, in terms of low-impact activities, we kind of want to use the same formula that we use with the general population, and that is, let's start off at a low intensity and gradually work our way up to more higher intensity exercises. Now, with tobacco users, that gradual increase in intensity may take a little bit longer, but it's certainly possible. One of the things that we can often use to judge the intensity that we should be exercising with is what's called the talk test. So when you exercise, you should be able to carry on a conversation with another individual. And if you have difficulty carrying on a conversation, if you find that you're laboring at all, if you need to have a break from the conversation to catch your breath, if your sentences are interrupted because you're catching your breath or you're huffing and puffing, then chances are your activity level is a bit too intensive. So you might want to go to a more lower intensive activity. Cost and resources, I've kind of touched on that. That's a problem for tobacco users as well as the general population. Sometimes there's just no resources or no facilities that are available, and there's not a lot of money around to participate in some activities. One thing that I find that when I talk to health practitioners, one of the things that they usually do is, in terms of resources, they'll use the shopping mall, for example, to get people to become more physically active. The shopping mall is a great place. Other than actual shopping, you can walk around. There's plenty of space to walk around. You don't have to worry about the weather, and it's free. Arenas can also be used for walking around, and I've even heard of people who have walking groups inside of schools. They ask for permission to use the school after hours, of course, and they'll have walking groups inside the school. So sometimes you just have to be a little bit more creative to get around some of these barriers. So in summary, adopting and maintaining a physically active lifestyle is advantageous to tobacco users, as it can help reduce morbidity and mortality. Also, tobacco users who are physically active tend to be more receptive to cessation, or at least try to attempt to quit smoking. Males, younger individuals, and single individuals are more likely to be active. And again, therefore, these people may be more inclined to adopt a physically active lifestyle, which may ultimately help them to quit smoking, or at least attempt to quit smoking. And challenges may arise in becoming physical activity. I talked about adherence, which is a very, very big problem. It's also motivation too. I mean, becoming motivated to adopt a new behavior can be very difficult at times. And some people just also think that they can't do it. And self-efficacy is another big problem as well. And I think it's important to remember that if we are going to prescribe an exercise regimen to tobacco users to become more physically active, that there's not a one-size-fits-all, and that we'll have to adjust any intervention based upon the motivational readiness of the individual as well as their self-confidence. And that's my presentation. Are there any questions today? So slide 15, let's see here. Somebody's asking if I said the age of 55 or 65. Let's see here. Sorry, I don't remember what slide 15 was. I'm assuming, oh yes, the life expectancy. So this is the number of years of life expectancy after the age of 65. Yeah, somebody's asking me if we can put the CML chart up again. There it is. So these results, as I mentioned before, they mimic what we see for the males, where ever smokers in the highly physical activity group have a higher life expectancy, active life expectancy, compared to never smokers who participate in low physical activity. And their active life expectancy is similar to those who are never smokers and participate at moderate levels of physical activity. So there's a question about what can be done to encourage more smokers to participate in physical activity as an intervention. Well, I mean, we can always talk about it from from an education standpoint, and we can outline the benefits, as I have done in this presentation, outline the benefits of why we should become more physically active and how that reduces our morbidity and mortality, and how it will change our smoking behavior as well. But what we could also do to encourage people is that maybe prescribe an education, like I said, prescribe a physical activity level that is very easy to participate in at first. One thing that has shown success in improving physical activity levels is the use of a pedometer. A pedometer is a very inexpensive device, very simple device, but when we use a pedometer, it kind of shows us an outcome that we can strive to achieve every day. So if I'm exercising with a pedometer, I've increased, or I've walked 1,000 steps today, and that kind of sets a goal for the next day, that maybe I'm going to try to reach 1,200 steps. It's all about seeing the actual outcome, and that can help us improve our physical activity levels among smokers. Recruiting people for physical activity programs. That's very difficult. Suggestions for recruiting people to participate in physical activity, that can be a very difficult thing. Just recruiting people in general, whether it's smokers or the general population, is difficult. Again, I think you just have to stress the importance of physical activity and make them aware of the fact that it can reduce their morbidity and mortality. Yeah, that's often difficult, as I touched on with adherence. People just don't want to participate in physical activity, so it is very challenging. But I think the best method is just to educate them on the negative consequences of tobacco use. When you say physical activity, does this include strength training and mindful movement-based exercises? It involves strength training, yes. We haven't really touched upon meditation or flow yoga, but it does involve strength training. I suppose that yoga and meditation can help as well. I don't know if it would be as successful as strength training or endurance training, but it would be interesting to see whether it does or not. Is there any best practice to implement for smokers who want to quit smoking? No, there actually isn't any best practice yet, and that's something that we'll have to look at in the future. Typically, like I said, it's best to start at a low-intensity exercise and work your way up gradually, of course. You don't want to incur any injuries or anything like that. But the short answer to your question, is there best practice? No, there is no best practice right now at the moment. Are there any suggestions for smokers working in the industrial setting to incorporate physical activity to reduce smoking at work? That's a tricky question. There are suggestions. I've seen studies that have looked at incorporating physical activity equipment room and equipment for individuals in the industry settings so that they have a place to exercise. You incorporate some kind of equipment room or whatever, and also giving people the time during work hours to exercise as well. Not to look at it from a different perspective outside of the industry setting. I mean, you could also, I've seen studies where people have been given vouchers to participate in a gym, and that has also worked as well to improve physical activity among smokers. But I think in terms of in the workplace, the best models for improving physical activity are typically ones where you provide that environment, that workout environment, the exercise equipment to participate, and you give them the time to participate as well. How do you serve those individuals who are really out of shape with combined mental health and chronic health conditions? That is very, very tricky. A very good question and very tricky. What you would have to do, there's a number of studies on that. There's one in particular, I think, by Dr. Faulkner, who looked at comorbidity among smokers and mental health issues, and trying to get them to become physically active. Again, it's very tricky. It's something that you have to, again, it's the same message where you start low at a low intensity and you work your way up to a much higher intensity physical activity. There's always that tricky part with mental illness, and they often use mental illness or smoking to deal with symptoms for mental illness as well. So I'd like to say that I do have a suggestion for that, but I don't at this time. It's very tricky to navigate that whole physical activity and tobacco use and mental health. Sorry about that. So one question is, are there any combined physical fitness and smoking cessation models out there to view? No, there's not. Not that I know of anyway. This is fairly a new topic, dealing with physical activity and tobacco use. So there's not really any new models out there on how to deal with it. That's something that we have to look at in the future. Again. So are you able to cite any research that supports pedometer use? There's one study in particular that was done here at CAMH in the workplace. I believe, I don't know the year of it, but it was by Dr. Carolyn Dewa, and I can't remember exactly what year it was. It was perhaps 2012, I'm guessing. But it was Dr. Carolyn Dewa that I can cite her research, how she looked at physical activity with the use of pedometers, and how physical activity, by incorporating a pedometer in the workplace, you could actually increase people's physical activity during the workday. Run to Quit is a new, somebody has a comment about Run to Quit. It's a new national program that aims to help people quit smoking by learning to run. I think that's funded by the Public Health Agency. It's a great program. It's actually just getting started. Sounds like a great idea. And it'll be very interesting to see what their results are in the near future. Somebody has a question about suggestions for pedometer apps and are they accurate? They are. I think they're just like any other pedometer. They are fairly accurate. They typically work best depending on the exercise that you do. So typically they work best for walking. Cycling or obviously playing any type of aggressive sport may not be the best case for pedometers, as they might have a few issues with the accuracy of their recording. But for jogging, but especially walking, they are fairly accurate. Yeah. So am I aware of any programs that have combined smoking cessation with physical activity that have been effective? Actual programs, there's a program called Prevent. Now that actually looks at physical activity and tobacco use, but it also looks at other behaviors as well, diet and I believe alcohol consumption. And the Prevent program is actually, it's done in the States, and it's actually very effective at looking at physical activity and smoking cessation. So there's another question about slide 18, and you have a better study that benefits, that shows the benefits, because it's only showing a reduction of 2 cigarettes is not very encouraging. Is there a better study? Unfortunately, no, I don't think there is a better study or any other study that looks at this difference between physical activity and physically inactive smokers and how their smoking or tobacco use is different. 2 cigarettes a day is, I don't know, I guess it depends on how you look at it. It is kind of encouraging, I think, because it is 2 cigarettes a day, and that is 14 cigarettes each and every week. So, I mean, it's a start. It may not be the best results that there are, but it is a start at reducing one's tobacco use. So, while I promote physical activity, the question is, while I promote physical activity, do you also suggest NRT? NRT can also be used with physical activity, absolutely. I don't believe there's any health risk associated with using NRT while being physically active. The thing is that it's kind of, the research out there has kind of been conflicting about whether physical activity does improve any or add any additional benefits outside of NRT. So, I mean, it's not going to hurt you by using physical activity and NRT at the same time, but the results just, they're kind of conflicting right now. From a research point of view, there's not much benefit for some studies, and others have shown there are. From a clinical standpoint, though, there are studies that have shown that, yes, we should incorporate physical activity with NRT. So I don't think there's a clear consensus on whether physical activity does add any additional benefit to NRT. But again, it depends on which study you look at. It's not going to hurt, it should not hurt the participant.
Jennifer, I see that you're asking about copies of the slides. So you can actually download a PDF copy of these slides right over here on the screen. If you just click on the title of the file name and then go down to click download file, you can have a copy there. Okay, and I also see a lot of you commenting on Evidence and other Run to Quit programs, so thank you for sharing that information. I don't see any other questions that have come up here. If you're joining via teleconference, you can push *1 on your phone to unmute your line if you want to ask a question that way. But please keep typing your question. We'll stay on for a few more minutes.
Yes, I have a question about Aboriginal populations, if there could be some comment on the data in comparison.
Sorry, in what way about the data? How
it would relate to the Aboriginal population? How accurate is this information relative to their activities?
Oh, okay. So you mean whether physical activity would produce the same results in the Aboriginal population? Is that what you mean?
Or if there are other studies that look at that population specifically and have a particular slant, or is this generally true?
Well, as far as I know, there isn't any research that has looked at physical activity and tobacco use within the Aboriginal population. So that is something that could be explored upon in the future. But I would just, it's just my opinion here, and I have no concrete evidence to back it up, but I would assume that we would kind of see similar results. Maybe not as high results, but I would guess that they would be quite similar.
Well, thank you for that.
Okay, so it doesn't look like anyone has any more questions at the moment. So, I mean, if you think of any, please feel free to email me your questions, and I'll forward them along to Wayne. So I guess we'll finish up a little early today.